Alright, so first I'm going to start off with elbow flexion. So we start with range of motion with elbow flexion. So first thing we're going to figure out is we're going to, down on my head, you hold your hand out this way. Is I'm going to palpate for the radial styloid process as well as the lateral epicondyle. And I'm going to make sure that my stationary arm, that when I'm measuring, I'm making sure that my stationary arm is parallel to his humerus. The axis of rotation is on that lateral epicondyle, and the movable arm is on the radial styloid process. So here's here, focus on this. Then go ahead and do like your bicep curl for me. I'm going to follow all the way through. And we're going to measure this way. Alright, so measured, we measure out to 128 degrees. Normal for elbow flexion is actually 145, so it's a little bit less than normal. That's okay, because it happens. Alright, then you scooch all the way back to where only your ankles are hanging off the edge of the hip caught here. Next one I'm going to demonstrate is ankle dorsiflexion. So with this one, your axis of rotation is actually going to be on the lateral malleolus. The movable arm is going to be parallel to the fifth metatarsal, and the stationary arm is going to be parallel to the fibula. So what I'm first going to do is I'm going to palpate for that fibular head, so I kind of get an idea of where my fibula is. Palpate for his lateral epicondyle. Scooch down just a little bit more down. Right in here. We're going to make sure that his fibular head is lined up there. And then we're looking for the base of the fifth to kind of give me an idea of where his fifth metatarsal is. Alright, Dad, I want you to bring your toes up to your face as far as you can. Good. Alright, go ahead and bring your foot back down. We're looking at degrees of dorsiflexion, which for dorsiflexion about 15 degrees is normal. I'll keep getting a little helper here. Alright, now the next one we're going to do, Dad, I'm going to have you stand for me real quick. And we're going to do some thoracolumbar side bending. So what you're going to do is you're going to have your hand just kind of out to your sides. Just nice and relaxed. I'm going to look at where his middle finger lands on his thigh. And usually I would put a mark here, but I'm not going to, kind of have to eyeball it here for a second. Dad, I want you to kind of bend down, going all the way down to your side. So what you're going to do is you're going to come this way, and you're just going to bend down as far, side bend down as far as you can. Good. I'm going to mark again about where his, so right down where at the bottom of his shorts is where his little finger lands. Alright, come up back, one more time. And then I'm going to take my tape measure, you don't have to side bend anymore. I'm going to take my tape measure and measure between the 2 points, focusing on centimeters. So right from where his here to where my finger is, we're looking at about 17 centimeters. Normal for this is going to be about 21, so he has a little bit of limited motion. Alright, now we're going to move on to the manual muscle test. So Dad, go ahead and have a seat again one more time for me. We'll move my little assistant here.
Which way?
No, just sit. You're good there. Okay. So now we're going to test the biceps brachii. The biceps brachii attaches at the radial tuberosity and originates on the supraglenoid fossa as well as the coracoid process. It's involved with elbow flexion as well as shoulder flexion. So how do we test this is we're going to have him do kind of like a bicep curl. I'm going to take one hand, going to kind of stabilize right behind the elbow. The other hand's going to Apply resistance down at his wrist. Dad, go ahead and bicep curl for me. Good. This one would be a 5 out of 5. And then now we're going to do for the gastrocnemius. The gastrocnemius is also one of the calf muscles. It attaches down from actually superior to the medial and lateral epicondyle of the femur and inserts down at the calcaneus. One way to test this is by doing a heel raise. So Dad, go ahead and stand up real quick for me. All right, I'm going to have you go up onto your toes as high as you can. Good. Go ahead and sit down for me, and then I want you to swing your feet towards the end. If you have somebody who is unable to get all the way up onto their toes due to an injury or just because they can't do it on their own, you can also test it while they're sitting. One way to test it is to stabilize the ankle and the lower leg down behind the ankle, making sure that you're not impinging on the actual heel bone. Putting your palm on the base of their foot and having them push down like they're pushing on a gas pedal. Push down. Good. Those are two different ways that you can manually muscle test that particular muscle. And then final one we're going to do is the Quadratus lumborum, which attaches from the iliac crest to the spinous processes, or the transverse processes of lumbar vertebrae 1 through 5, and to the bottom of rib 12. So Dad, go ahead and lay down. It's responsible for, helps with extending the lower spine, as well as side bending, and is involved with hiking the hip. So what I'm going to have my dad do is I'm going to have him try to hike his hip, and I'm going to take his leg and try to pull back down and pull it back into where he was. So Dad, I'm going to have you try to hike your hip for me. Nope, you don't have to bend your knee, just try to basically slide your leg up to your head. Nope. Keep your leg straight. You're just going to slide your hip. Nope.
That's sorry.
You're going to basically try to take your leg and go that direction.
Oh, this way.
Yep, just like that. And then what I'm going to do is come in here. I'm going to pick my dad's leg up. I'm going to stabilize here at his ankle and at his knee, just to make sure that I'm not pulling too much on those joints that may be hurting. And then I'm going to have him hike your hip for me, Dad. Good. And keep it there. I'm going to pull. Good. That would be a 5 out of 5 since he was able to maintain that contraction without releasing while I pulled on it.